Hello and welcome. I am Cynthia Reed and I am the Senior VP of Marketing and Communications for the Greater Oklahoma City Chamber. We're really excited today to have Jana Steelman, who is the Vice President of Communications for the United Way of Central Oklahoma, here to talk about some of the things that they are doing right now to help our community respond to this crisis. Jana, welcome. Thank you for coming on and talking to us a little bit. I think everybody may be slightly familiar with the United Way, but why don't you kind of give us a little brief overview of what the United Way of Central Oklahoma is all about?
Sure. Well, the United Way of Central Oklahoma has actually been around since 1929 in our community. And we just really work to help build a stronger community. We direct resources to health and human service agencies. We conduct research to help us better understand our community's needs. And then we convene with stakeholders to come up with solutions to some of our community's most pressing challenges.
Okay. How have things been going in your office? When would you say activities started to pick up related to this situation?
Well, in our office, we are all just kind of like everyone else trying to adjust to the new normal, and we're all becoming very acquainted with Zoom. And we're lucky that we're able to continue working and continue providing our services. It just might look a little bit differently right now. Things, we really started watching COVID-19 just due to the nature of our agency in times of disaster, and when early on, when it first spread to the U.S. And then I think like the rest of us on March 11th, it just became really real for Oklahoma City. And then I'd say since March 16th, we've been in full-on disaster response mode at the United Way.
How did the idea for this new fund evolve?
Well, we have experience in disaster response funds and have created similar funds in similar types of disasters. So we were able to put our COVID-19 response fund into place pretty quickly. And our board of trustees they were actually able to take action and establish this fund on March 17th. So just our strong relationships with our donors and our corporate partners, we were not only able to quickly enact the fund, but then quickly kind of turn around and begin distributing those dollars to our partner agencies.
You've done similar funds like this before, I think, as well.
Yes, we have been responding to disasters in the community for many years. We've had a disaster response fund in the wake of the 1995 bombing, after the May 3rd, 99 tornadoes, and many other disasters. And so in each case, we were just able to very efficiently collect resources from our donors and then make sure they went to help as many people as possible with the highest level of accountability, because these are our partner agencies that we're very familiar with and just have the utmost trust that they're using those dollars wisely.
So how much money have you raised so far?
Well, currently we have about $1.2 million pledged to the COVID-19 response fund. And again, we are just so grateful for the outpouring of support from our steadfast donors like the Loves and the Gaylord Foundation, to hundreds of donors who have utilized our Text to Give mobile platform and given. We've just really seen the Oklahoma standard once again with the outpouring of support from the community.
So how are you already using these funds?
Well, soon after we established the fund, we convened a committee to begin evaluating applications. I should back up and say we started accepting applications from our partner agencies, those who were having immediate needs due to COVID-19. And so as quickly as March 30th, we were able to begin distributing emergency funds. The committee meets on an ongoing basis as our applications come in and the requests come in, and evaluate those and distribute those dollars back out. Currently, I believe we've distributed around $825,000 to 21 different partner agencies in the community. So that's one thing that we really heard from our agencies, especially a week or two ago before these federal funds were available. They needed the money right then, and we were lucky to be able to quickly get it out the door.
And that's great how quickly you were able to start meeting those community needs because they're definitely out there right now.
Definitely, yes.
So are you still accepting donations to this fund? Because, this crisis is going to go on for quite some time.
This is true. Yes, we are. Just with the uncertainty of this virus, we foresee needs continuing to arise well into the future, and we just never know what those might be. So you can still donate to the fund. You can text to give. If you text COVID OKC, COVID OKC to 41444, you can make a donation. Or you can also visit our website at unitedwayokc.org and make a donation. And we're excited. Next week, we're actually partnering with KOCO, and they're going to feature our fund and our agencies and the great work that they're doing in the community throughout the week. And so we hope people will just tune in and learn more about the support that we're helping our agencies provide.
Jana, are there any unmet needs you know of right now that you can help people understand the scope of really where these monies might be going and some things that we know we need to try and address?
Absolutely. The needs and the requests from our agencies continue to come in. Many of the requests are just for basic living expenses. Many people who have maybe never reached out for help before, they're finding themselves suddenly unemployed and struggling just to keep the roof over their heads. And so our agencies are helping them pay rent, they're helping them pay for their utilities, basic needs, hygiene items, cleaning supplies, not only for clients, but also for our agencies. Some of our daycare agencies are they're having to disinfect, and just their cleaning costs are skyrocketing. There's also a huge need for mental health, and some of the funding has gone to telehealth services to ensure that they are able to connect and continue serving their clients. Let them visit their caseworker or their counselor via Zoom. And so just kind of putting some of those technologies in place that they hadn't really had before. So there's just a plethora of needs in the community.
We've talked a lot on this call about giving help, but you're also very involved in helping people get help. So what's the best way for someone if they've got a need and they don't know who to call and they don't know how to reach out? What do they do?
So one of our partner agencies that we work with is Heartline, and they provide the 211 phone service. So anyone in Central Oklahoma who's looking for help, you might not know which specific agency or nonprofit to call, just dial 211, and they 24 hours a day are answering the phones and help. They can really assess the needs and determine what resources they can connect the caller to. And sometimes it's just, if you're uncertain and you're scared, it's just a friendly, comforting voice to talk to during this time of crisis.
Yeah, it's easy to feel overwhelmed right now. So it's nice to have a one-stop shop for someone that can help unwind all of the details.
Absolutely.
Okay, is there anything else, Jana, that you want to talk about?
I think just if we've learned anything during this time of uncertainty, it's that none of us are immune to this pandemic. The effects are so widespread, and like we talked about, probably not even fully realized yet. And so we just are so lucky in this community to have such strong nonprofits who have been able to adapt and keep their doors open and serve unprecedented numbers of clients. and we're equally as lucky and grateful for the outpouring of support from the community, and we're just very appreciative of that.
We're definitely all in this together.
Yes.
Thank you, Jana, so much for sharing some information about this with us today. Why don't you also share again your website?
Absolutely. It's unitedwayokc.org.
Super. Thank you, Jana, and have a great day.
Thanks, you too.